We are currently working through this particular challenge in the public health volunteer programs. Way back in January, we had just 1,400 registrants in the Maine Response emergency volunteer system. This count has since doubled due to the attention that COVID-19 and the media brought to our operations. We are about to hit 2,800 members, which is just incredible. With a combination of both existing and new volunteers, we've created 3 new volunteer initiatives from scratch to address emergent needs. The Maine Spiritual Care Response Team provides interfaith grief counseling and other services. Currently, the volunteers that are a part of this initiative are focused on supporting long-term care facilities and nursing homes. The Maine Frontline Warm Line provides psychological first aid supports to all of Maine's first responders. This initiative is the result of our partnership with the Office of Behavioral Health, the Maine Association of Psychiatric Physicians, the Maine Disaster Behavioral Health Response Team, and Maine 211. Finally, the Maine School Nurse Corps is training now to support the Maine 211 phone line in any questions requiring more nuanced medical insight than their existing operators are able to provide. This last initiative is in partnership with the Maine Department of Education and Maine CDC's Public Health Nursing Team. As you can understand from the examples above, your creative approach to adapting to COVID-19 should extend to both current and new organizational partnerships, as well as possible new opportunities for service presented by emergent needs in your community. If your resources or staffing are limited right now, think about who else may be trying to accomplish the same or similar work, and be sure to reach out to them. I also have to mention that the Maine Medical Reserve Corps has actually quadrupled in size since January, so we're looking forward to engaging with new local volunteers and potential volunteer leaders and better organizing our structure once the intense COVID-19 response concludes. If you choose to alter your screening processes as a result of increased interest, make sure that whatever you do, your process continues to support your mission and does not compromise the safety and security of your work. Generally speaking, I would always advise against loosening screening, as safety and reliability are paramount for the long-term success of any voluntary organization. Mostly, you should just need to scale up your existing processes. If screening has traditionally been performed only by staff within your organization, consider if a volunteer could assist with screening tasks. I trained a couple volunteers to assist with our screening of Maine Response volunteers. This work saw them searching public-facing portals, and unlike me, they're better able to focus on the task at hand right now. So this actually improved our turnaround time. It also helps to break down your screening process into its constituent parts, and to think about your approach something like an assembly line. Are there parts of the process that are easily given to a volunteer so that they can complete them on their own time or in their own place of residence and then hand them back to you for the next step? Onboarding warrants its own separate discussion. This is likely to look very different now than it normally does for your organization. Right now, in-person interviews are not advised. There are various web conferencing platforms out there, and many offer free trials or have special offers for nonprofits and voluntary organizations, so you may want to consider one of these for your interviews. Of course, a good old-fashioned phone-based interview is also a great option right now. Training, similar to interviewing, should almost all occur remotely, either by phone or online. If in-person training is required for certain essential and physically performed functions, remember to maintain a 6-foot distance between all participants and instructors, and group size should continue to be under 10. As you onboard new volunteers, I highly recommend that you include additional support you may not have previously considered, such as providing behavioral health resources for individuals experiencing anxiety, worry, anger, or other strong emotions as a result of COVID-19. You may find that some of your staff and volunteers, no matter how seasoned they are, suddenly behave and react very differently from how they normally do. It is important to remember that everyone is experiencing this public health crisis in a different way, depending on how their self, their family, and their friends may have been impacted. Maine DHHS's Office of Behavioral Health recently launched a useful resource page with information that may help your organization to plan for these needs. The link to that webpage will be shared along with this video. Finally, if your organization is seeing an influx of many new volunteers, you'll have to think carefully about how to keep them engaged and how you will establish a level of familiarity and personal connection while maintaining a good distance. Regular remote check-in meetings, either online or by phone, are a great way to touch base. You can have a standing agenda, but also keep in mind that some unstructured time, even within agenda-based meetings, would be quite helpful. Unstructured interactions are more limited than they might normally be because folks are working from their personal residences. One idea is to have lunch together once or twice a week over a web conferencing platform. Actually, my wife's team, the Maine Childhood Lead Poisoning Prevention Program here at Maine CDC, is hosting such ongoing lunch meetings via web conference this exact way, and they're really enjoying the camaraderie that it provides to them. For more information on the Maine Medical Reserve Corps, please visit mainemrc.org. If you'd like to register for any of our public health volunteer programs, you can visit mainresponds.org to sign up. In closing, I must reiterate, based on new data or re-examination of existing information, current guidance could quickly change. The most important thing you can do as a volunteer leader during the novel coronavirus outbreak is to keep up to date on the latest guidance from the state of Maine by monitoring maine.gov and the Maine CDC's website. Thank you for listening and for helping all of Maine to protect our family, friends, and neighbors during the COVID-19 response. I also want to give special thanks to Volunteer Maine for giving us the opportunity to share this valuable information with volunteer leaders across our state. Take care and stay safe.